Listening 1.
My name is Dr. Chowdhury, and I am a GP working in an inner-city area in London, just on the edge of the East End. I started work as a GP in this area over 20 years ago. In recent years, many developments, both technological and social, have occurred, affecting the practice enormously. I enjoyed my work here a lot at the beginning, and I still do now. But there are many problems in an area like this, which you would not find in rural communities in this country or in my home country, India. The crime rates are high, which affects the morale of the patients we serve and ultimately the morale of the GP practice. The workload is heavier than in most rural districts, which sometimes puts potential GPs off moving into the area. However, I have always found the job very rewarding. Another feature of an inner-city GP practice is that patients move around a lot. As regards compensation for working in deprived areas in the inner city, sometimes GPs receive extra payment.
When hearing the term medical equipment, a typical layman whose only knowledge about healthcare comes from an annual checkup at a local surgery and TV shows such as House MD or ER might think of complex devices like a defibrillator. However, medical equipment might refer to both very complex devices used by professionals as well as to simple instruments which you might even use yourself. Imagine you wake up in the morning with a terrible headache, feeling feverish. You quickly phone the boss and say you need a day off, then grab a thermometer to take the temperature. Gosh, it's 102 degrees Fahrenheit. You really need to go to the doctor's. After you arrive at your local clinic and wait some time in a queue, the GP asks you in. She asks what is wrong and then puts a tongue depressor in your mouth to see your throat. Then she asks you to take off your sweater and uses a stethoscope to listen to your chest. Finally, she tells you that you have caught the flu, prescribes you some medicine, and says you must stay at home for a couple of days. As you can see, several pieces of equipment are used even in such a common procedure like diagnosing flu, some of which you may even have at home. What about other examples? Let's see what equipment might be used in case of a broken bone. It's mid-February and you are skiing in the Rockies. You're having an amazing time, but you fall and feel terrible pain in both your shin and your arm. You have probably broken your arm and your leg. It's so painful you can't move, so you call out Mountain Rescue. They come by chopper, put you on a stretcher, use a splint to immobilize your limbs, and take you to the hospital. You are told you have broken your leg and it's put in a cast. If you're lucky and your arm is not broken, it's only wrapped in bandage, and you have to wear a sling. As a result, walking on crutches is out of the question, so you leave the hospital in a wheelchair. But how do the doctors make sure your limb is broken or not? Well, you have an X-ray taken. What other gear is used in hospitals? Let's study a case of a person brought to an A&E department with a head injury. The person is brought by paramedics who have already put a brace on his or her neck in order to prevent further injury. Firstly, diagnostic equipment is put to use in order to check the person's condition. An MRI scan is taken to check for bleeding and swelling in the brain. If immediate surgery is required, the patient is administered an anesthetic by means of a syringe. Then a surgeon uses a scalpel to cut into his or her body and forceps to manipulate the tissues. After the surgery is performed, a catheter is inserted for the time when he or she is immobilized. Various types of medical equipment, ranging from basic tools to highly advanced cutting-edge devices, are used in very different situations. One thing is certain, each piece has been developed to help us recover or even save our lives. And we might need them at the very beginning of our lives, as is the case with an incubator, which is used in neonatal units to help or treat prematurely born children.
Listening 2.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm.
Mm-hmm.
I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks?
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week.
Mm-hmm.
It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Unit 1, Task 8.
Come in, Mr. Green. Come and sit down here. I've had a letter from your doctor, and she tells me that you've been having pain in your chest.
Yes, and in my arm, and also tingling in my fingers. And
Yes. Now, when did you first notice this pain?
Well, I suppose about 6 months ago.
And can you remember when it first came on?
Yes, well, I remember I got a bad pain in my chest when I was shopping. It was so bad I couldn't breathe. And...
Where? In which part of your chest did you feel the pain?
well, right across my chest.
And how long did it last?
About 10 minutes.
And what did you do when it happened?
Well, I just stop and wait for it to go away.
So, have you had this, the pain, again since then?
Yes, I often get it when I overdo things and,
I think at this stage I'd like to examine you, your chest, so if you could strip to your waist.
Right. There we are.
That's fine. Fine, I'll just check your pulse first of all. Fine. That's fine. It's quite normal. 70 per minute.
Right.
Now your blood pressure. fine. That's quite normal too. 130/80.
Oh, I'm pleased to hear it.
Now, I'm going to listen to your heart, so I want you to breathe normally. Your heart sounds quite normal.
Well, that's a relief.
Well, now I want you to take deep breaths in and out while I check your lungs. In. Out. In. Out. Fine. They're completely clear. Well, Mr. Green, the pain you've been having sounds very much like the pain of what we call angina.
Ah.
And this occurs when not enough oxygen is getting to the heart. Now, I'd like to check a few tests, and following that, I'll be able to advise some treatment for you.
The primary functions of the digestive system are the breakdown of food, called digestion, and absorption of nutrients. Digestion begins in the mouth, where the teeth break food into smaller particles during mastication. Salivary glands located near the oral cavity secrete saliva, which begins chemical digestion and keeps the food moist. As food is swallowed, the soft palate blocks the upper pharynx to prevent food from entering the nasal cavity, and multiple voluntary muscles in the face, neck, and tongue contract, pushing food particles through the pharynx. The food passes over the epiglottis, which prevents food entry into the respiratory system, and then into the esophagus, which connects the pharynx to the stomach. The one-way movement of the food mass, now called a bolus, is controlled by wave-like involuntary muscle contractions. This movement is known as peristalsis. The bolus now enters the stomach. Folds in the stomach wall called rugae allow for expansion as the stomach fills. Stomach cells secrete hydrochloric acid, pepsinogen, and various regulatory hormones that chemically digest the bolus. Muscular contractions in the stomach churn its contents to further break down the bolus and mix it with stomach secretions to form a thick liquid called chyme. Chyme exits the stomach through the pyloric sphincter and enters the small intestine, the major site of nutrient absorption. The small intestine consists of three parts: the duodenum, jejunum, and ileum. Bile from the liver and digestive enzymes from the pancreas empty into the duodenum to aid in digestion. Absorbed nutrients pass from the lumen of the small intestine into blood and lymph. Chyme not absorbed in the small intestine enters the large intestine. As it passes through the cecum and ascending, transverse, descending, and sigmoid colon, water and salts are absorbed and chyme is converted into feces. The rectum stores feces until nervous stimulation initiates the defecation reflex, resulting in elimination through the anal canal.
Nadine Hartman's colonoscopy and biopsy results have arrived from pathology. I've got them here. Shall we go through them together?
Right. I'll be glad of your help understanding them. Path lab reports are like a secret code.
Like everything, they're easy when you know how. Look at this, for example. At the top of the page, polyp of sigmoid colon.
Polyp of sigmoid colon?
That's the specimen they analysed.
I see. A polyp from her lower colon.
So it goes on, polyp of sigmoid colon, measuring 0.6 by 0.4 by 0.3 centimetres. That's the size of the specimen.
Right.
Next bit, a mushroom-shaped specimen surrounded by mucus. That's what the specimen looks like. Then it says no evidence of stromal invasion.
What does that mean?
That means there is no cancer.
So does it give a diagnosis?
Read what it says at the bottom of the page. Under summary, it says colon sigmoid, endoscopic biopsy, tubular adenoma.
Let me work it out. The organ involved is the lower colon. That's where they got the biopsy using an endoscope. The diagnosis is a tubular adenoma.
That's right, a benign tumour. She hasn't got cancer, but there is a danger of getting it in the future.
So, do you want to be a hero today? Well, there is a great need for blood donations around the world, and you can be the means of saving lives. According to the American Red Cross, over 40,000 blood donations are needed every single day in the United States alone. And without the help of volunteers like you, it is impossible to fill this need. About 9.2 million people donate every year in the U.S., and although approximately 38% of the population is eligible to donate, less than 10% of them actually do. Sometimes people don't donate out of fear, but the process is relatively simple, following a 4-step process: registering, getting your medical history checked, donating, and then having some refreshments. And once you donate, you have the ability to donate red blood cells every 56 days. So carefully consider becoming a hero today. Donate blood, and you can save lives.
ListenAminute.com. Blood. I hate the sight of blood. Looking at it makes me go all weak at the knees. I can't even look at my own blood. I don't know why. The thing I hate most is giving blood for a medical check. I fainted once after I saw my blood in a small bottle. If I have a nosebleed, I have to sit down for 30 minutes before I feel better. It's impossible for me to watch operations on TV. I wish I could donate blood to others. I can't. I know giving blood is really important, but I'm not brave enough. One thing about blood I do find interesting is blood types. I think your blood type can affect your personality. I know that in some countries, people with blood type A would not be a good romantic match for someone with blood type O.
Welcome to Spotlight. I'm Ryan Gertzma.
And I'm Liz Wade. Spotlight uses a special English method of broadcasting. It is easier for people to understand no matter where in the world they live.
Imagine this situation. You are walking down a city street. A person on a bicycle rides past you. On his 2 wheels, he is traveling very fast. But suddenly, you hear a terrible noise. An accident. A car has hit the bicycle. Someone is crying with pain. You walk quickly to the accident. The bicycle rider is lying on the ground. His leg is badly injured. It is broken. What would you do?
Treating a hurt person quickly is called first aid. First aid does not require expert medical help. Anyone can learn first aid. Today's Spotlight is the 5th program in a series on first aid. We will be talking about broken bones. How would you help someone with a broken bone?
Broken bones are also called fractures. There are many different kinds of fractures, but all of them need medical help. You cannot just treat a broken bone yourself. However, first aid is still very important. Treating the victim carefully at the beginning can mean a better recovery later.
First, look at the break. What treatment does it need? A fracture is sometimes very clear. For example, with a broken wrist, you may be able to see that bones do not line up normally. Sometimes the bone even breaks through the skin. Even when a break is not clear like this, it can be very serious. All fractures should be treated the same way.
After you have looked, stop any bleeding. If there is a bleeding wound, cover it with a clean cloth or bandage. Then, press on it lightly. Do this carefully so that you do not damage any bones. You can also learn more in our program about bleeding injuries.
When the bleeding has stopped, support the injury. Your main goal is to prevent the broken arm or leg from moving more. Moving can cause the bone to break more. The sharp pieces of bone can also cut and damage soft muscles and nerves. This makes it much more difficult for the injury to heal.
To support the injury, use a splint. A splint can be anything hard and long. For example, you could use a piece of cardboard from a box, or any smooth piece of wood. You can even use rolled newspapers or magazines. Add something soft to the splint to make it more comfortable. Something like blankets or clothes. Tie the arm or leg to the splint. Use any soft material or bandage for these ties. Do not use anything sharp like wire. Tie 2 bandages above the break and 2 below.
For an arm or wrist fracture, you can also use a sling. A sling is a piece of cloth. It is shaped like a triangle. You can lie the arm down across the triangle so that the wrist is at one of the points. Then, tie the other 2 points behind the victim's neck. The arm will lie across the victim's chest. The cloth will hold it in place. The wrist should be held higher than the elbow.
Use ice so that the injured area does not swell and get larger. Do not put ice directly onto the skin. Instead, place it in a clean cloth and put the cloth on the skin. This will also ease the victim's pain.
Now you will be ready to bring the victim to a medical center. There, doctors or nurses can set the bone. They can get the bones back to their correct position. Do not try to straighten the break yourself. Pulling on the broken bone can cause more damage. If the break is very bad, the victim may even need an operation.
Finally, there are a few things you should never do. Do not encourage the victim to move the injured area to find out if it is broken. This can cause more damage. Do not rub the area around the break. This could cause more damage to the bones. Do not move the person without the support of a splint. And do not give the victim anything to eat. If he does need an operation, this can cause problems.
Broken bones can happen in many different situations. Kimberly Stubbs is 17 years old. She studies sports science, and she learned first aid at a young age. She also leads a sports group, teaching other young people. It was in this group that she used her first aid training. One day, one of her students had a very bad fall. Her student broke her arm. The bone damaged an artery, one of the main tubes that carry blood through the body. The student was bleeding a lot. It was a dangerous situation. Kimberly told her local newspaper about the accident.
It was a bad fall. Blood was pouring out of her arm. It made me afraid. But my first thought was to put pressure on the wound to stop the bleeding. I knew she could lose too much blood too quickly. Luckily, this did stop the bleeding. I had to keep the pressure on until the emergency workers arrived. They took her to the hospital, where she had an operation. Luckily, she has recovered well. She comes back to the group, so I still teach her every week.
Without Kimberly's help, the student would have died. Kimberly stopped the bleeding, but she also did not do anything to make the injury worse. She did not move the student, and she did not try to treat the break herself. Kimberly's first aid training made all the difference. She said,
"It makes me proud that I have used my first aid experience to help save a life."
There are many different kinds of accidents. Each of them needs different first aid help. The right, quick action can save a person's life.
In another program, we will look at first aid for some other injuries and accidents. If you are interested in first aid, you can learn more. Ask your local doctor or hospital where you can train in first aid. You never know. you could save a life.
The writer of this program was Christy Van Aragon. The producer was Diana Anderson. The voices you heard were from the United States. All quotes were adapted for this program and voiced by Spotlight. You can listen to this program again and read it on the internet at www.radioenglish.net. This program is called First Aid – Broken Bones.
You can also leave your comments on our website. Or you can email us at radio@radioenglish.net. You can also find us on Facebook. Just search for Spotlight Radio. We hope you can join us again for the next Spotlight program. Goodbye.
What's your occupation?
I'm a painter.
Right. What's your date of birth?
1st of the 9th, 82.
1982. And where were you born?
Karachi, Pakistan.
What's your marital status?
Sorry?
Are you married?
No, I am single.
And do you have a contact telephone number for your next of kin?
07709 401 229. It's my brother, Yusuf.
Do you smoke?
Yes.
How many do you smoke a day?
20 a day.
Uh-huh. Do you drink?
No.
Right. Are you allergic to anything?
No.
Now, family history. Do any of your close family suffer from any of the following? Mental illness?
No.
Diabetes?
My mother's parents are both diabetic.
Maternal grandparents? Diabetes? Tuberculosis?
No.
HIV/AIDS?
No.
Unit 7. Task 10.
Well, Mr. Jameson, I am sorry to see that your back is still causing you pain, and that you have now developed a weakness in your right foot. The weakness is due to the continued pressure on the nerve roots supplying the muscles of your leg. This pressure, of course, is taking place at the level of the disc between the lumbar vertebrae. Due to this worsening of the condition, I think that there is now a strong possibility that you require an operation on the back to remove the disc where it's pressing on the nerve.
I see.
The operation will need to be carried out by a surgeon specialised in this work, a neurosurgeon. The operation itself will only immobilise you for a few days, and you'll soon be up and about again and back to the physiotherapist to improve the strength of your muscles, both in your back and this leg. If you don't have the operation, the risk is that your right foot will be permanently weak. We want to avoid this at all costs. Are there any questions you would like to ask me?
Unit 7. Task 15.
The diameter of one of your coronary arteries is reduced, so one part of your heart muscle is starved of oxygen and other nutrients. If you don't have an operation, you'll continue to have pain in your chest and you may even have a further heart attack. Before serious damage is done, we must try to improve the flow of blood to the heart. We're going to remove a vein from your leg and use it to replace part of your coronary artery. The chances of recovery are very good, and I'm confident you'll feel a lot more comfortable after the operation.